Alright, so for the next muscle and it's more of like a muscle and bone issue, but this is more of like on the surface we are looking, right? Muscle issue. Look at what's known as what asymmetrical thigh or gluteal folds. So it's just simple, you understand? Like, let me say for this baby, they have what, 2 folds on this leg. All right, one leg is what, 1 fold. Of course, that's to tell you that what, one of the leg is longer than the other one. Do you understand? It's as literal as that. So it can be subtle, right? It can be a subtle clue during routine physical examination. So it's not really a thing that a mother will notice and what reports to you. But you now, maybe as they give birth to the baby, as the baby is coming to the clinic, over time, as you were examining the baby, you got to notice it. You understand? So what does it mean? All right. So the folds refers to what, skin creases on the thigh or buttocks. All right, that may appear what, uneven. All right, from side to side. Okay. So while they can be normal, especially in chubby babies, sometimes they indicate that what, the hip joint of the baby has dislocated. So that's what they are. And as we're examining the baby using this technique, that's what they call the Otto-Lani and the Barlow test. You understand? So most of the times they indicate that the baby's hip joint has a problem that needs to be checked. Right? So when to take closer look, if the gluteal fold asymmetry is more of concern, if especially one leg appears to be shorter than the other one. Okay, now you kept the baby and the baby is standing with the two, like is, you know, okay, on this position with the 2 leg, but one of the knees higher than the other one. Then you now know that okay, it's actually becoming a serious condition. All right, if there's limited hip abduction, so the ability of the baby to take take one leg aside is limited, or the baby is crying when you try to do that. Okay, if the baby has a limping or waddling gait when walking, so these signs may prompt further evaluation using ultrasound. All right, if the baby is under 6 months, or you might want to now still opt in for x-rays after 4 months. I don't really understand this, but I think x-ray should be right when the baby is like 10 months old and all. So what the research says, so studies show that isolated asymmetrical thigh creases may be false positive, all right, and have low predictive value for what, developmental dysplasia of the hip. You understand? It's not always that it indicates that you are having this developmental dysplasia of the hip, right? But you know, it could be one of the signs in which you can actually use to diagnosing the DDH. Okay, so that's it.